Let's get to our big COVID story of the morning. Indiana just passed 1 million cases of COVID since the pandemic began.
And so the focus now is on prevention and testing as well. And so our Karen is actually live with us this morning, letting us know kind of that new push and how testing is changing for us.
Yeah, I mean, especially as we enter the fall and winter months. I mean, 1 million cases, that's a lot right there. So we know that 1 in 7 Hoosiers, that's what about 1 million cases equals. 1 in 7 Hoosiers have tested positive for this virus. Now we want to break down, of course, all of these numbers and show you right here on your screen. You see it in big, bold, orange numbers. That's where we're sitting at today. Now, moving on to the next slide, we know that about 49% of Indiana's total population is fully vaccinated. Now, looking at this graph, you can see the peak in September, that's where we hit. If you go down toward where we are today, you can see the steady decline in the number of positive cases. Now, we also know that there has been a decline in the number of people who were hospitalized and, of course, the number of deaths that have happened from those who have tested positive. But we want you to know, looking at this graph here, this is the peak here in mid-September. Again, you can see that steady decline as we enter into late October. Now, we do want to mention that the Indiana Health Department, they say that the number of people who have been hospitalized with COVID, 98% of those people have not been vaccinated. Now, the Marion County Public Health Department, they are now offering a 1-month supply of what's called a Quick View Rapid COVID Test to Indy residents who live in zip codes with high rates of COVID cases, lower vaccination rates, and high numbers of essential workers. And the free kits can be mailed to your home by filling out an online form or picked up at one of 5 health department locations. Take a listen.
We're hoping that this may be a critical tool to identify those individuals who are unaware that they're infected, and so we can get them out of that social environment where they may be infecting others unknowingly.
Now, again, the name of the test called Quick View. These are at-home tests. You can use a nose swab and a test strip. Now, another tool to help lower COVID cases, those booster shots that we've been talking about. The CDC is expected to meet this week to discuss those boosters for both Johnson & Johnson and Moderna. Julia.
Well, thank you, Karen. And speaking of that, we're learning that the FDA is likely to allow people to mix and match those shots for a booster. So that's according to the New York Times report. New data presented to the agency last week showed that mixing boosters is safe and could provide a strong response to the Delta variant. The Times report says that the FDA might prefer Americans to get the same shot, but won't recommend one booster over another. So as of now, a meeting to vote on that topic hasn't quite been scheduled just yet. Carlos?